everyone out there on Burst TV. My name is Stephanie Botts. I'm a clinical dental hygienist as well as ergonomics specialist, offering ergonomic coaching to dental practitioners to help them practice safer. So as you guys all know, we have a very physically demanding job in dentistry, and so my goal is to help clinicians learn how to practice safer, how to take care of their bodies, and make sure that they have a long and healthy career. So thank you, Burst TV, for allowing me this opportunity to share some really quick ergonomic tips with everyone. Today, I would like this to be very short and sweet, but I'd like to focus on establishing neutral posture and incorporating something called micro breaks into our day. Before we get into establishing neutral posture, I just want to explain a little bit about ergonomics first. So ergonomics is the science of fitting the workplace to the worker, and we're the worker. So our workplace comprises everything in our operatory that isn't us. So it's our patient chair, it's our patient, it's our instruments, it's how we're interacting with our operatory and our delivery system. But all of that should be adjusted to support us in neutral posture. And that's why it's so important for us to establish neutral first, because that gives us a foundation and a base for which to adjust everything else in our operatory to support us in neutral posture.
So we're going to talk about establishing neutral posture first. So you're going to sit on your stool, and then you want to raise the level of your stool to get your hips above your knees. And then you'll tip the seat pan forward just slightly to open up the angle of your hips, which reduces the pressure on the low back. And then you have your arms close to your sides and your elbows bent at 90 degrees. So you want the patient's head about at that elbow level when your arms are bent at 90 degrees. And then to get neutral neck posture, you want to make sure your ear is in line with your shoulder, which is then in line with your hip. So you should have one straight line from your ear to shoulder to hip. So I'm going to show you a couple stretches that are really good. You're going to want to find a time that you can set your instruments down, and we're going to stretch out the trapezius muscle. So take one hand, point it down towards the floor, take your other hand and pull your head to the opposite side. So you should feel a nice stretch there in the side of the neck, but keep that tension in the arm that's pointing down towards the floor, because you can get a really nice stretch along the neck and even down into the shoulder as well. So you're gonna hold that for 20 seconds. And then you're gonna switch sides and do the other arm. So take that hand, point it down towards the floor, pull your head to the side, and again, feel that nice stretch along the side of the neck and into the shoulder. But the key here is to hold these stretches, no matter what stretch it is, for 20 seconds. So our trapezius muscle gets a lot of stress when we're practicing dentistry because of hunching, abducting our arms away from our body. And then when we're working on patients, we're typically forward and hunched over, and that puts a lot of stress on the trap. So very important to keep those stretched out several times during the day. Now we're gonna stretch our wrists and our forearm muscles. These get tight because of pinch force. So let's stretch out the wrists and forearms. So you're gonna punch your arm out in front of you, make a fist, point that fist down towards the floor, and you should feel a nice stretch on the top of the arm, but keep your shoulder down. And then if you want a deeper stretch, you can grab your fist and pull it down even more towards the floor. But the key here is to hold that stretch for about 20 seconds. Flip your hand over to get the flexors on the inside of the forearm. And again, keep your shoulder down, but you're gonna pull your palm down towards the floor, and then you're gonna hold this stretch for 20 seconds. So when doing that stretch, just keep that shoulder down. So you wanna do these stretches for 20 seconds each, and that'll really help you with fatigue at the end of the day.
So those are just a couple parts of what ergonomics is. There's so many different facets to ergonomics, but it's very important for us to establish our neutral posture and then incorporate those micro breaks during the day, okay? Very important to do those. If you have any questions, if you need help with ergonomics, please use me as a resource. My contact information is listed below. Again, my name is Stephanie, and thank you so much for your time today. Thank you, Burst.